Welcome to the next presentation of the Grand Canyon Baha'i Conference. Our speakers will be Dr. Shahrzad Saririan and Dr. Farshad Marvasti. Their talk is titled, The Global Health Crisis, Communities in Action, A Pathway to Health Equity. Shahrzad is a family physician at Golden Gate Community Health Center in Phoenix, Arizona, and also works in academic medicine as the director of the Primary Care Scholars Program and Family, Community and Preventative Medicine Clerkship at the University of Arizona College of Medicine in Phoenix. Among her current academic interests are how to advance discourses on social determinants of health and the role of community in addressing health inequities. She is part of a greater Association for Baha'i Studies working group on defining health and has presented her work on this subject at several conferences. She is currently a member of the Phoenix Baha'i Community, where she serves in the neighborhood surrounding Golden Gate Community Center in South Central and West Phoenix. Her most recent area of focus has been to establish community building activities in community health centers and surrounding neighborhoods, and efforts to address the social determinants of health. Farshad is a physician, public health educator, and author who is actively engaged in creating solutions to promote health and prevent chronic diseases through an understanding of social, behavioral, and lifestyle determinants of health. He currently serves as Associate Professor, Director of Public Health, Prevention and Health Promotion, and the founder of the Culinary Medicine Program at the University Arizona College of Medicine, Phoenix. As a Baha'i, he serves on various institutions, both elected and appointed. He has been engaged in community building activities in several neighborhoods, including in the Creighton neighborhood of Phoenix. We hope you will enjoy their presentation.
Hi, everyone, and welcome to the Grand Canyon Baha'i Conference 2020 session on global health crisis, advancing the discourse on health and the role of community. This COVID pandemic has unveiled our system failures, health inequities, systemic racism, and social issues. It has disrupted every aspect of life in every corner of the world. The issue of racism has emerged as the main feature of our national conversation. For Baha'is, it is clear that the principle of the oneness of humanity is the theme that connects every question as to how society should be structured. Radical change in the system itself and a completely new order and social structure must be created and is what is needed. In the light of this global health crisis, we can see the value of community more than ever. It is important for us to be actively involved in the prevalent discourses of society, namely on health, health equity, racial unity, drawing from current scientific understanding on health and on Baha'u'llah's divine revelation, and finding that point of unity in our elevated conversations with others. In this session, we'll briefly explore the current state of the COVID pandemic, lessons learned from this global health crisis. We will explore social determinants of health and structural racism and its role during this pandemic. And finally, the role of community building activities, and the divine plan in addressing social determinants of health and the global health crisis. We will draw from previous and recent messages from the Universal House of Justice.
So to start with, we're going to kind of look at some quotes and some thoughts, and this is from a Nobel laureate that talks about gives us some perspective on this global pandemic with COVID-19. The microbe that felled one child in a distant continent yesterday can reach yours today and seed a global pandemic tomorrow. How can we procrastinate any further, have any reservations about a common cause, one that responds to every outbreak of disease anywhere as a challenge to all of us? So those of us who are familiar with the writings of Baha'u'llah, we know that he prophetically proclaimed in his revelation, in his writings, about how the whole human population, the whole human community around the world is basically akin to a human body. And when one part of this body is afflicted, it will be a source of affliction for all the others, and that we should be looking at all of us holistically. And so this is one of the many lessons I think that this COVID-19 pandemic has unveiled. This is just a snapshot of one of the great resources that are out there in the medical, scientific, public health community, the Johns Hopkins University website kind of dashboard looking at this. I know that this number has already gone up since we've recorded this. One thing that's notable, I think, for every country, you've seen a great amount of exposure and basically unveiling to be able to read what our reality is because of this virus. One such unveiling, for example, in the United States is the fact that we're 4% of the world's population, yet we have had to date, I believe, about 20% of all the cases and 20% of all the deaths. And so you start to look at how we've been dealing with things and other issues that kind of are emerging as part of this. And the Universal House of Justice, commenting on this in the very recent 25 November letter, has said that there is a mounting realization on the part of the world's people that the decades ahead are set to bring with them challenges among the most daunting that the human family has ever had to face. The current global health crisis is but one such challenge, the ultimate severity of whose cost, both lives and livelihoods, is yet unknown. Your efforts to succor and support one another, as well as your sisters and brothers in society at large, will certainly need to be sustained and in places expanded. So, prophetically speaking to the fact that this is not the only challenge, this is one such challenge of many that we will be facing. And for us to look at this and see what is the impact and what have we learned and what can we read of this reality, as I was alluding to. So, if you think about COVID as like the great unveiler, there's many disparities and health inequities and challenges that have been exposed, and just challenges of leadership and just our ability to approach health and wellness. In the United States, for example, we have a great deal of work to do in terms of health disparities. We've seen the variation globally, with more developed countries having some social safety net programs to support lockdowns and stay-at-home policies. Some developed countries have done a better job of this than others by paying folks to stay home, paying small businesses to stay home at the height of the risk of the pandemic for mitigation, whereas others have had a patchwork, the United States being one of those, the patchwork. And then you see that the poor are often working in essential jobs at higher risk due to lack of physical distancing, such as service industries, farming, and food processing plants. So there's inherent disparities already emerging just in the shape of what people have to do every day for work, where they have to go, in addition to the policies of the governments in terms of whether or not we're actually supporting people or not. And this is also a reflection of spiritual principles like elimination of extremes of wealth and poverty, which we look at as a spiritual solution to economic issues. Again, this is being unveiled and more pronounced in terms of what's being shown with this pandemic. In the United States, as well as other parts of the world, we can see the impact of systemic structural racism that's been around literally for hundreds of years, but now being again exposed even further to read the reality beneath the veil that COVID-19 has lifted. Many in the Baha'i community have obviously been striving for race unity and trying to address this for many decades, but for it to come to light now, the lack of equal access to higher paying jobs, in terms of access to opportunities, less medical care, preventive services, we'll talk a little bit more about that, baseline chronic diseases and living conditions in terms of being in areas that foster infectious disease transmission. And we also now see the need for leadership both on a state and local level, a national level in the United States, as well as globally to collaborate, right? One of the scientists involved is quoted as saying that measuring the progress in responding and controlling COVID-19 as well as future epidemics and pandemics will not be achieved merely by extrapolating current trends. The future of our health depends more upon the degree to which we as a global society mature to the next stage of our collective existence, that of unity and interdependence. Recognizing that something that started in China, right, over 11 months ago could have been contained and may have been mitigated in much better fashion had we had this system of unity and interdependence of a global government and a global civilization where we're working more hand in hand together Think about how that could have been totally different, as opposed to the haphazard approach that basically took us by storm, and we didn't have a chance to even get in front of it before it was too late. And this idea of interdependence as being a critical part of it, how wars, civil disturbances, and subsequent displacement of peoples, basically, this is a big part of what sets us up and predisposes us to these pandemics. And following, in this case, looking at the lessons learned from previous pandemics, from SARS, Ebola, for example, experts have proposed frameworks and enhancements for existing global governance structures to more effectively acknowledge this interconnectedness, and really looking at a framework for global cooperation in these areas. You could also add to this list looking at the global burden of chronic disease. And again, another reason why maybe in the US we've been disproportionate in the numbers of Black and Brown in terms of impact of the COVID-19, as well as just in general as a society, even, looking at the fact that we lead the world in chronic disease and obesity. But again, the need for interdependence is so critical. And now kind of coming more specifically to the United States, being a member of the global community must show concern and act when there are outbreaks, epidemics, and pandemics, just as we would if they were members of our own family. We must visualize and recognize that we're all fellow world citizens, striving to build a healthier US and a healthier world. So this idea of kind of xenophobia or isolationist policies that divide us or separate us from the rest of the world, you can see in the era of COVID-19 how destructive those things can be, and how important it is to have those structures in place for global governance interaction. These are some of the lessons learned in terms of unveiling. And the House of Justice, echoing some of the scientists that we quoted here, we ardently pray that the American people will grasp the possibilities of this moment to create a consequential reform of the social order that will free it from the pernicious effects of racial prejudice and will hasten the attainment of a past, diverse, and united society that can increasingly manifest the oneness of the human family. This is the pivot around which the covenant of our faith revolves. Such a critical concept, and with having so many implications. As the Guardian has said, it's not a mere cry of emotionalism or a restatement of the spirit of brotherhood. Rather, it has far-reaching implications regarding the evolution of human society and the political and economic and societal interdependence of each other that we have because of the fact that we're really part of one family. And so when we look at this and look at communities in action, the House of Justice continues to guide us on this, and this is going back to the letter in Nowruz 2020. We are sure that you, like us, have felt great concern for the well-being of humanity, especially for those who are most vulnerable. Seldom has it been more evident that society's collective strength is dependent on the unity it can manifest in action from the international stage to the grassroots, and we know that you are giving your support to the essential efforts being made in this regard to protect the health and welfare of all. And we can see how from the grassroots all the way up to the collective, we work locally and we have impact globally, all right? And so that's kind of what it's all about. And this pandemic, again, has unveiled opportunities also for us to recognize the value of this. And if we continue to do more of this development of this global framework by starting locally and then expanding to that impact globally, then we can be ready for future pandemics and future challenges that humanity faces. And there will be multiple challenges, as the Universal House of Justice has said in the quote that we had earlier from the 25th November letter. And it's important for us to be outspoken and engaged in the discourse of our time, to have these types of discussions, to look at the science, but then look at the spiritual implications of the science and look at what spiritual principles apply. So Baha'i contributions to discourses, newly prevalent society, are generating heightened interest, and there's a responsibility to be discharged here too. At a time when the urgencies of attaining higher levels of unity, founded on the incontestable truth of humanity's oneness, is becoming apparent, society stands in need of clear voices that can articulate the spiritual principles that underlie such aspiration. So we're just starting to kind of touch on the surface of this, but the hope is that this kind of session inspires you, and we invite you to reach out to us, and hopefully we can all connect with each other to look at what are the spiritual principles involved. What have we learned? We're outlining a few of the concepts that we've seen in our neighborhoods, in our community, but I'm sure all of us have a great perspective to add to be able to learn collectively what are the spiritual principles that underlie what's happening. And whether it's through deeds or words, every contribution to social well-being, first in your resolute commitment to discover that what is the point of unity, right? This is another point that was emphasized in the most recent letter where there's contrasting perspectives, right? You remember the concept of false dichotomies, right? That phrase is in Letters from the Universal House of Justice before, in terms of looking at our community building efforts and our approach to teaching and expansion. Well, we have other false dichotomies presenting themselves in the politics of division, right? You're either, for science, or for maths, or you're completely anti, right? Are we for this way or that way, right? Are we going to save the economy, or are we going to save people's lives, right? Well, this is a false dichotomy. We can save the economy and we can save people's lives, right? When you bring spiritual and scientific principles together, you're able to find solutions. So that's what we have to do as Baha'is. We have to find that point of unity where there's contrasting perspectives. Look at the overlap like in a Venn diagram to see when people are contending. We're not here to support one camp or the other, but we're here to find the overlap based on science and spiritual principles together to see what the reasoned, thoughtful approach is. Again, that's a point of unity that we can all focus on. And that, humbly is kind of where we feel that as Baha'is we should be focusing. So, as we continue to do that, we need to look at ways where we can, look at collective consciousness. So leaders, prominent thinkers, commentators, they've started to explore fundamental concepts and bold aspirations in recent times, but this has been largely absent from public discourse. And so again, because of those false dichotomies and these extremes and people getting into partisanship, and God forbid Baha'is get involved in that kind of division, right? And really latch onto one camp or another, we're not able to see the glimmerings of this bigger picture, this collective consciousness, which really is focused on unity and our goal of developing an ever advancing civilization, which is really what we need to keep focused on and not get caught up in the day-to-day bickering and divisive partisanship that really, unfortunately, has infected a great part of our population here in the US, and definitely in other ways in other parts of the world.
And again, in the light of our understanding of our interconnectedness, that we're all dependent on each other, Shoghi Effendi says, we cannot segregate the human heart from the environment outside us and say that once one of these is reformed, everything will be improved. Man is organic with the world. His inner life molds the environment, is in itself also deeply affected by it. The one acts upon the other, and every abiding change in the life of man is a result of these mutual reactions. So this is an important concept in the Baha'i faith that you will see applies when we look at the determinants of health in our efforts with community building activities. In the current scientific and medical understanding of health, we recognize that there are several factors that determine our health. A number of studies have attempted to assess the impact of social factors on health. A more recent review estimated that medical care was responsible for only 10 to 15% of preventable mortality in the US. Studies suggest that health behaviors such as smoking, diet, and exercise, and socioeconomic factors are the primary drivers of health outcomes, and social and economic factors can shape individuals' health behaviors. Social determinants of health are the conditions in which people live, work, play, and grow up that can have a significant impact on health outcomes. These complex social structures and economic systems are responsible for most health inequities. So here are some examples of social determinants of health. Our economic stability, our income and how much financial support we have, the neighborhood we live in, the safety of our physical environment. Can we safely go out for walks? Are there parks and transportation? Our education and literacy level, access to early childhood education, access to food, healthy, nutritious food especially, our community and social context, how socially integrated we are, our social support, healthcare access and quality of care. And you can see that racism and discrimination impacts all these determinants of health. Here you can see that the social determinants of health are all interconnected. So one impacts others. You can't really look at them independently. A few words on food insecurity. The statistics on food insecurity refer to the very low insecurity, which is someone who doesn't have enough food. However, we know that a much greater percentage of Americans have low food insecurity and are unable to get quality, nutritious food. So in 2014, 17.4 million US households were food insecure during the year. In 2016, 31.6% of low-income households were food insecure. And we know that certain populations are more likely to be food insecure, such as Black households, Hispanics, unemployed individuals, and individuals with disability. So food desert is an area that has limited access to fresh fruit, vegetables, and other healthy foods. Predominantly in a lower socioeconomic neighborhood, Black and Hispanic neighborhoods have fewer full-service supermarket than white neighborhoods. So how the city is designed and your access to transportation can impact your access to healthier food. You will notice that in lower socioeconomic neighborhoods in the US, there are less grocery stores and more convenience stores that obviously don't carry healthy, nutritious food. So if you don't have a car or access to good public transportation, this intensifies the problem. There is emerging research pointing to the role of environment where you live. The social and economic factors of neighborhoods impact population health. So your zip code may determine your health more than you think. Here's a map of life expectancy based on zip codes in the Phoenix metropolitan area. For those of you who are familiar with the Valley of the Sun, you can see that in some neighborhoods such as Scottsdale or Paradise Valley, the life expectancy is at 85. And then to contrast that, you have the South Central Phoenix area where the community health center where I work is located, hit the most by COVID. The life expectancy there is at 71, a huge drop from 85. So it's not surprising that there is a direct correlation between household income and life expectancy. The higher is the household income, the longer one lives. This is a great graph illustrating the COVID risk factors for severe outcomes. Obesity is an independent risk factor. And then you have chronic diseases such as diabetes, hypertension, cardiovascular disease, and pulmonary disease. And of course, all the social determinants of health influence these comorbidities, but also independently adversely impact severity of COVID outcomes without any other illness. So what we call race-based medicine amplifies and contributes to systemic racism. Race is a social construct and changes over time. There are no overlying genetic or biological factors that unite a racial category. So race is not an appropriate marker for disease state or risk and should not be included in medical diagnosis and treatment. Using race as a surrogate marker increases health disparities. This is part of eliminating systemic racism in healthcare, understanding that we're all one human race. Now, you may have heard that some populations are more greatly affected by COVID-19, such as African Americans, Native Americans, and Hispanics. There was a cohort population-based study published in the New England Journal of Medicine that examined the role of race in risk of mortality. The study showed that race alone, independent of social factors like low income, residence, health insurance status, and comorbidities like obesity. So in other words, when we adjusted for these factors, race was not a factor for mortality. So this study highlights once more the impact of social determinants of health and that race in and itself is not a determinant of health.
So a lot of this stuff that you just saw in terms of looking at social determinants of health and looking at the impact that these social ailments actually has medically and biologically on our health outcomes, which are very real scientific implications, you know, are really been around for a long time, right? And as the famous playwright said, not everything that is faced can be changed, but nothing can be changed until it is faced. And obviously, James Baldwin, as an African American, faced many of such challenges in the course of his lifetimes. And the reality is that it's really long overdue. So when we think about it, these things, these disparities didn't come about with COVID-19. For the Black community, this is a legacy of over 400 years from the time of slavery, you know, where we have persistent disparities well before COVID. These stats, you know, 60% more likely to be diagnosed with diabetes, twice as likely to have complications, 71% 5-year survival rate for breast cancer for Black women versus 86% for white women. Lack of equitable care in cancer, basically leading to poor outcomes. A number of studies have shown that. We've also seen cardiovascular disease, 50% higher mortality in African Americans. Black women are 3 or 4 times more likely to experience pregnancy-related death than their white counterparts. Mental health, basically the risk of suicide, and also just mortality because of the systemic structural racism, whether it's from the police or other forms of violence that occur to young Black men. Only 1 in 3 African Americans who need mental health care because of all these microaggressions that occur over the course of a lifetime that increase your blood pressure and actually increase inflammation and lead to the chronic diseases of our time. So we're looking a little bit deeper into this whole issue of race, and as was mentioned before, there is no biological foundation for race. It's really a social construct. And we see this have played out over decades with segregation. All these principles come to bear and have been unveiled, the implications of which are now playing out with this pandemic, with the higher rate of complication disproportionate among Black Americans. You know, they weren't able to get the loans that they needed to be able to get homes, whereas white folks were able to do that. The segregation that occurred, the redlining of districts, and really what we find actually when you look at areas where there's more diversity in the United States, there's actually more segregation, where there's actually groups of different ethnicities living separately. So when you look at, and we're going to talk more about this later, the community building activities in the Institute process, the goal of these activities is to break down those barriers and bring these communities and diverse neighborhoods together, recognizing that we're part of one human family. So what are some of the spiritual principles that we kind of identified? One was the elimination of prejudice of all kinds, the oneness of humanity, elimination of extremes of wealth and poverty, equality between women and men. All of these things play out with social determinants of health. And speaking to racial disparities, another one, again, just to kind of point this out, in COVID-19 deaths, it just kind of breaks it down, where you can see the disproportionate impact that this has on Black and Brown Americans. And this is really something that is unnecessary and can be prevented, but it is inevitable as a result of the hundreds of years of systemic structural racism and all the different components of this which have been playing out to basically set us up for this type of disaster. Just think about the hurricanes that happened and the disasters and how these communities were disproportionately impacted there. And so this disaster again, like those, same thing happening again. And so we've got strong statements about this, and we really need to take more of a leadership role when we're looking at spiritual principles and scientific realities and the implications with this global health crisis. Racism comes right in the crosshairs, as it has been, and it should be finally again seeing the light of day with the local, the tragedies that we see here in this last year. Racism is the most challenging issue, right? And a nation that espouses the pluribus unum, whose ideals of freedom under law have inspired millions, but yet we see this affront to human dignity, a cause of hatred and division and disease that continues to devastate. And now Universal House of Justice saying this is a profound deviation from the standard of true morality. It deprives a portion of humanity the opportunity to cultivate and express the full range of their capability to live a meaningful and flourishing life while blighting the progress of the rest of humankind. This is not a Black or brown issue. This is a human issue. It blights the progress of the rest of humanity. It eclipses the light of our splendor as human beings to have this disease continue to be there, to develop these inequities that we see. What we need is we need to have no more this designation of anyone as the other. We need this change, which is not merely social and economic, but also moral and spiritual. And one of the clarity points here, I think, which is important to make, is equality versus equity. We talk a lot about equality. You hear about equality. Equality really refers to equal opportunity, same levels of support for all levels of society. Well, the problem is when people start already disadvantaged, right? And you can see this in this illustration, right? You can see where when you're already disadvantaged to begin with, if you just get equal proportions of support, that's going to result in a disproportionate impact, because this guy already started ahead. This lady already started ahead. This guy was already well behind. So if you just got an equal opportunity, you're still going to be behind. You need to give more to those who have less to be able to get to an equal playing field. That's what equity means, okay? To achieve greater fairness of outcomes. And in health, equity means giving patients the care they need when they need it, okay? And it doesn't vary just because of those characteristics. That's what we need to aspire to. The data that came out this year, where they found that Black doctors treating Black people, that the Black patients with the same diagnosis, same economic situation, had better outcomes when they were treated by Black doctors, right? Why is that? Why can't white doctors treat Black doctors equally, right? We all need to strive for that, right? And in medicine, we all have to strive for that, and just in as human beings. So, kind of going from there, thinking about health promotion, the World Health Organization has talked about health promotion as a process of enabling people to increase control over the determinants of health, right? So shifting the dialogue just to focusing on disease and waiting to a reactive disease management system. The same way with chronic diseases, we just let them go and we can prevent them, right? We can prevent a heart attack decades before it happens if we focus on lifestyle and we focus on diet. Promoting health, we can prevent the tragedies of Black and Brown Americans dying at a higher rate from COVID-19 by addressing the health inequities of systemic structural racism ahead of time, right? The same concept of health, we need to be focusing on the spiritual principles, eliminating extremes of wealth and poverty so that we don't get this disproportionate impact with life expectancy and the zip codes that Shahrzad showed us earlier in the slide. And that leads us to this.
So on an international front, the United Nations had done a study some time ago in the 80s that tried to determine why so much money and resources were spent on aid and so little had been accomplished. So not seeing much difference in outcome despite all the aid. And the committee, at the end of their investigation, concluded that there was a lack of moral leadership, leading to misuse of funds and corruption. So the issue of moral leadership in social development has become a fundamental issue in the world. Baha'is must constantly contribute to this effort. There's a great need for moral leadership globally and social development in the world. In looking at the scientific data and the role of community and relationships, I'd like to share some more interesting findings. I've shared these studies before. Some of you may be familiar with the 80-some-year Harvard study of adult development, one of the longest studies of adult life, which is fascinating because it's very hard to do a longitudinal study that is that long. So 80 years ago, they started following over 268 Harvard sophomore men during the Great Depression, following them along the years, collecting data on their physical and mental health, hoping to get more data on indication of health outcome. We're now in the second generation of these families. They expanded their studies to include 1,300 of their offspring, and women and wives were included somewhat later in the study. Over the years, researchers have studied the participants' health trajectories and their broader lives, including triumphs and failures in careers and marriage. Now, they recently administered a survey to the millennials and asked them, if you had to invest your time in something that would help you achieve healthier and happier lives, what would that be? And the millennials' #1 answer was building wealth. That was the most common answer among the millennials. The second most common answer was fame, not surprising. And this 80-some-old study showed significant correlation between the quality of our relationships and our health, both physical and mental. Not necessarily committed relationships, but relationships in which the person felt happy, loved, and safe. In fact, if you were in relationships that were abusive or that you couldn't trust the person, it had a negative impact on your health. So close, authentic, symmetrical, and loving relationships were predictors of health outcomes more than social class, IQ, and even genes. The people who were the most satisfied with their relationships at the age of 50 were the healthiest at the age of 80. Those ties protect people from mental and physical decline and are better predictors of longevity. So again, kind of highlighting the importance of relationships and community. So other interesting studies that highlight that similar findings as the Harvard study are the Sardinian studies in the blue zone. We know that in developed countries, women outlive men by many years. However, in this Italian island in the middle of the Mediterranean, Sardinia, men live as long as women and far more than other towns. It's a super longevity town. Obviously, this is an interesting population to study, and there are many studies looking at different factors that could explain this difference, including genetic studies and diet. We know that from multiple studies that 15 to 20% of our health and life expectancy is determined by genetic, and 75% by our lifestyle, health behaviors, and social determinants. They started analyzing and observing what was so different about this town. It's an architecturally dense town. The streets and alleys are interwoven. Villagers intersect a lot. There's a lot of social cohesion, suggesting, again, the importance of social integration, relationships, and community. Being closely involved in community activities help maintain a healthy mental state, which is critical to overall well-being. And obviously now in the light of the pandemic, we can see more than ever the value of community. So what's the purpose of religion? Baha'u'llah says, the fundamental purpose animating the faith of God and his religion is to safeguard the interests and promote the unity of the human race, and to foster the spirit of love and fellowship amongst men. So in essence, the purpose of religion is to help us have happier and healthier lives as individuals and communities. Shoghi Effendi states, if certain social assumptions and religious formula have ceased to promote the welfare of the generality of mankind, if they no longer minister to the needs of a continuously evolving humanity, let them be swept away. For legal standards, political and economic theories are solely designed to safeguard the interests of humanity as a whole, and not humanity to be crucified for the preservation of the integrity of any particular law or doctrine. This is a powerful quote from Shoghi Effendi, and also in the midst of COVID and the decisions we are making on a political level globally. So Baha'is believe that true religion is not an ideology. The laws of God are there to help humans and their preservation, not to sacrifice the human for the preservation of a set of ideas. So the Universal House of Justice in its January 2019 letter states that our challenge is that humanity is gripped by a crisis of identity. As various people and groups struggle to define themselves, their place in the world, and how they should act, without a vision of shared identity and common purpose, they fall into competing ideology and power struggles. We need a shared common vision. This was from the letter dated January 18, 2019. Next slide. Next. Shoghi Effendi states that the chief reason for the evils now rampant in society is the lack of spirituality. The materialistic civilization of our age has so much absorbed the energy and interests of mankind that people in general no longer feel the necessity of raising themselves above the forces and conditions of their daily material existence. There is not sufficient demand to things that we call spiritual, to differentiate them from the needs and requirements of our physical existence. Even in global health, we have come to realize and accept that there is an increasing need for moral leadership based on World Health Report over the last decade. So man's merit lieth in service and virtue, Baha'u'llah says, and not in the pageantry of wealth and riches. And further, dissipate not the wealth of your precious lives in the pursuit of evil and corrupt affection, nor let it endeavors be sent in promoting your personal interests. By consecrating oneself to the service of others, one finds meaning and purpose in life and contributes to the upliftment of society itself. Therefore, we know that we need a common vision, a shared purpose. We know that the chief reasons for the evils in society is the lack of spirituality, and our merit lies in service and virtue. And in essence, the purpose of our faith is to establish unity through meaningful, symmetrical, authentic, loving relationships and communities as we develop a foundation toward achieving true unity. So from the Nowruz Letter 2020, the House of Justice states, the world stands more and more in need of hope and the strength of spirit that faith imparts. Beloved friends, you have of course long been occupied with the work of nurturing within groups of souls precisely the attributes that are required at this time: unity and fellow feeling, knowledge and understanding, a spirit of collective worship and common endeavor. As Baha'is, we know that we are not isolated individuals when standing alone the onslaught of the forces of moral decay operating in society. We are members of purposeful community, global in scope, pursuing a bold spiritual mission, working to establish a pattern of activity and administrative structure suited to a humanity entering in its age of maturity. The framework of the plan promotes the transformation of the individual in conjunction with social transformation as two inseparable processes. The service that we render as part of the Institute process helps lift the individual out of the confines and places him or her in a dynamic process of community building. In its May 2020 letter, the House of Justice states that naturally the activities that we undertake must suit the prevailing conditions. Those activities are intended to cultivate a thriving community spirit through which resilience to mighty challenges is also strengthened. Educational efforts, meaning the Institute process, aim to rise up a growing number of souls who can contribute to the spiritual and material well-being of a community. Devotional meetings nurture the spirit of service as it blossoms, rooting it in a culture of collective worship. In short, the promotion of the plan implies building capacity to walk the path of service in every time and season, which must surely include moments of acute peril in the life of humanity, such as now. It is essential then that steps being taken to learn how to apply the plan's framework for action to the current circumstances of the world continue in earnest. Again, in its May 2020 letter, the House of Justice highlights that special attention must be given to those who are at most at risk from the virus itself or from the economic impact of its spread. So who is our vulnerable population? We talked about that. And then goes on to say, networks of various kinds comprising families, neighboring households, or other groupings are offering valuable support to many. You should be confident in the resourcefulness of your communities and seek to draw on their talents and energies to the fullest. So how does this process begin? It begins with a small group of friends. Every community has a part to play in building a just, equitable global civilization. In any setting, the pursuit of this noble goal can start with a small group committed to bringing about the desired change. Their love for their neighbors, friends, and coworkers impels them to straighten relationship and see the true spiritual nature of those around them. Conversations like these allow more and more people to reflect on the current state of the world, to see possibilities for change, to recognize the spiritual forces required, and to develop commitment to contribute their part. Early on or a little later, these souls may participate in activities that enable them to regularly interact with the Word of God, the change of hearts. As they engage in a process to transform themselves and their communities, they grow in capacity to serve and naturally invite others to join. So this is really how those elevated conversations start in those group settings with your neighbors and coworkers. And then slowly they start engaging in that community building process.
And that's where, the process, kind of the community building process and the divine plan meets the science and the evidence that's been building, which shows the impact that the social, behavioral, and lifestyle determinants of health have on our outcomes. So really building that capacity building being the watchword that, as the Universal House of Just says, to be able to expand, to embrace diverse populations, to address these social determinants, basically to strengthen the spiritual foundation of villages and neighborhoods, and to address certain social and economic needs, to contribute to the discourses prevalent in society. So this is basically the essence of the goal, right, of the series of global plans and the Institute process. It's basically this, what it is addressing is directly addressing the social determinants of health, which science is now showing to be the key to actually determining better health outcomes, medically, public health, individually, mental health, all the above, right? When you're addressing these social issues, you're actually making healthier communities physically and in multiple dimensions of human life. So the way that this capacity is built, as you all know, is through a series of acts of service, the practice of which creates capacity in the individual to meet the exigencies of dynamic developing communities, right? So the betterment of the world is accomplished by pure and goodly deeds. We know that each of the Institute books carry with them resources and basically developing skills. So you obtain the knowledge, the skills, and basically the attitudes to the transformation that occurs in engaging in the process and engaging in the field, in serving and getting out there, just trying, calling a neighbor, doing something to elevate that conversation, just pushing yourself into that uncomfortable position initially, and then it just starts to bear fruit. And there's so many great stories out there of people sharing how that can make an impact. But the beauty of it is we're now seeing that it actually can make an impact in terms of their health and well-being, as well as their spiritual well-being. So the goal of all of this is to establish a dynamic pattern of action that will lead to sound development of local communities. And this goes back to the studies that Shahrzad was mentioning in terms of developing those healthy, authentic relationships. When we do that, we also break the cycle of ideology, right? We see so much division coming right now with ideologues and demagogues on one side or the other, where people are following a charismatic figure and an ideology, and that's causing division. Well, religion is not supposed to be that. And we're not here to sacrifice each other or others for these, just these concepts, because that's not what the Guardian says. We don't want to do, crazy things, like, honor killing or other things like that, which really don't make any sense at all in the revelation of Baha'u'llah. So the capacity building that happens here, as the Universal House of Justice says in this letter from December 29, 2015, the chief aim is to initiate a process for building capacity within the cluster through which its inhabitants, prompted by a wish to contribute to the spiritual and material well-being of their communities, are enabled to begin offering acts of service, nurturing a spirit of common purpose. And that's where you build those communities with those authentic relationships individually and at a community level that basically interweave and address the social determinants of health and improve our ability to address the issues that have been unveiled with this COVID-19 pandemic that have been long assailing us. And so to do this, again, just another quote here that kind of calls this out, social action really emerges. And this is an example from the Universal House of Justice that talks about how this can develop and what forms it can take. So the forms that such endeavors can assume are diverse, including tutorial assistance to children, to better the physical environment, or projects to better physical environment, activities to improve health and prevent disease. Some initiatives, basically in some places, have been founding a community school at the grassroots, And these all naturally flow from the study of the Institute materials. And then however humble it may be, we know that this social action might be at the beginning. It is an indication of people cultivating with themselves a critical capacity, one that holds infinite potential and significance for the centuries ahead, learning how to apply the revelation to the manifold dimensions of social existence. Again, finding the underlying spiritual principles for the social determinants and the challenges that we're facing and things that have been unveiled to our eyes with the crises that we're facing. And one example is community health workers. This is an example where they basically looked at, from the main sequence, you could look at it as a trunk of a tree which supports the courses branching from it. For example, a set of health materials were being developed in Africa offered a good illustration of a few features of such courses. Following years of training, community health workers and several Baha'i agencies decided to elaborate a series of modules aimed at preparing individuals to deal with progressively more complex health issues at a local level. By the time the first module began, the Institute process had gained some strength, and it became evidence that those who studied Book 1 and 2 were better prepared to visit members of their extended families to address these health-related subjects and talk about them. And then, remember the idea of like visiting and connecting with others, right? So this is community building 101. But this also allows us to have the skill sets to address those social determinants, to address those public health issues, right? So this example illustrates how branch courses are not a disconnected connection of materials randomly placed at various points, but they rather emerge out of actual experience and adhere to a certain logic, both internally in the context of the overall Institute program. So the hope is here that this helps to more and more we find ways of addressing specific needs in every locality by addressing the principles, developing the knowledge, skills, and attitudes through the Institute process and the community building process. And so, in short, we must, this transformation can really be impactful when it actually enters the realm of culture. So social action can become an occasion to raise collective consciousness of such vital principles, again, the spiritual principles applying to the disparities of our age, oneness, justice, equality of women and men. I called out some of these earlier, the promote environment distinguished by traits such as truthfulness, equity, trustworthiness, and generosity. So this is where we're going to get to this level of culture, which ultimately will contribute to a ever advancing global civilization. And by so doing, we're able to undo, right, the age-old atrocities, right, and diseases like racism. So for example, the concepts and approaches for social transformation developed in the current series of plans can be utilized to promote race unity in the context of community building, social action, and involvement in the discourses of society. Every believer, as the promulgator of Baha'u'llah's central principle, the oneness of humanity, should deeply meditate upon it and weigh its demanding implications for the profound alteration of thought and action required at this time. So much for us to reflect on and much for us to do. And this also from the National Spiritual Assembly on the same topic, activities at the core of our community life. Again, the example of racism as being one of these social determinants. Foundation for great social change, simple as they may appear, they are in reality profound and revolutionary. All these activities must increase and grow to embrace multitudes of individuals in an ever-largening number of neighborhoods. For example, we will learn how best and most effectively to work among diverse populations among the practical dimensions of interracial fellowship. Such activity and the genuine friendships, remember the impact of meaningful, authentic relationships that result, will help to weaken and eventually uproot prejudice-tainted notions underlying our present social order and can begin to undo racism in our society, one generation at a time. And with that, just want to say that, all of this kind of leads to community building, which is basically the qualities of mutual support, reciprocity, and service to one another. As Abdul-Baha says, service to humanity is service to God. That's kind of the culture, and starting that culture of service, and finding that point of unity. That's where our role is as we're emerging from this global pandemic. How can we be of service to each other? How can we find points of unity? How can we have elevated conversations to develop those meaningful, authentic, and important relationships? And we can all work together towards this end.
Ultimately, the power to transform the world is affected by love. Love originating from the relationship with the divine. Love ablaze among members of a community. Love extended without restriction to every human being. This divine love, ignited by the word of God, is disseminated by enkindled souls through intimate conversations that create susceptibilities in human hearts, open minds to moral persuasion, and loosen the hold of biased norms and social system so that they can gradually take on a new form in keeping the requirements of humanity's age of maturity. You are the channels for this divine love. Let it flow through you to all who cross your path. Infuse it into every neighborhood and social space in which you move to build capacity to canalize the society-building power of Baha'u'llah's revelation. There can be no rest until this destined outcome is achieved. From the Universal House of Justice, July 2020 letter. As we prepare now for the upcoming 1-year plan, followed by the 9-year plan, the House of Justice states this: this final year of the final plan, in a series spanning the final quarter of the opening century of the formative age, will seal the foundation upon which will rest the next series of global undertakings. It is the concluding act in a captivating drama whose end is yet unwritten. And we will end with these thoughts from the Universal House of Justice. May your minds be ever bent upon the needs of the communities to which you belong, the condition of the societies in which you live, and the welfare of the entire family of humanity, to whom you're all brothers and sisters. Thank you.
Thank you.